My name is Carla Gaona and my topic will be on Zika awareness among Fresno State College students. Zika is a mosquito-borne virus that primarily spreads to humans through mosquito bites of an infected Aedes species mosquito. The virus can also be transmitted between humans through sexual intercourse with an infected individual or from a pregnant woman to their fetus during pregnancy or birth. Therefore, the main ways individuals can protect themselves from contracting or spreading the disease is to avoid mosquito bites and use protection when having intercourse, especially pregnant women. Zika is difficult to detect since many will have little to no symptoms. If individuals do experience symptoms, they tend to include headache, fever, joint pain, red eyes, rash, and muscle pain. Zika infection during a woman's pregnancy can cause birth defects in the brain of the fetus, like microcephaly, as well as hearing deficits, eye defects, and impaired growth, among others. Nervous system illnesses like Guillain-Barré syndrome have also been linked with Zika, all of which can have long-term effects on both the child and mother. Some of the main issues with this virus is the fact that it is difficult to detect. As of right now, there's no treatment or vaccine that prevents the disease, but research efforts to create one are underway. Zika virus is an emergent disease that caused various national and international outbreaks in 2016. In that year, the World Health Organization declared Zika a public health emergency of international concern. That year, there were 5,102 symptomatic cases that were reported to the CDC. Keep in mind, this number does not account for all those asymptomatic cases that were never detected. This year, as of October 17, 2017, there has been a total of 2,246 cases of pregnant women with Zika reported to the U.S., which in turn shows the need to maintain our focus on the disease and continue prevention efforts, especially in vulnerable populations. The trans-theoretical model of change will be used as the theoretical framework for this study. The model, also known as the Stages of Change model, was developed by DiClemente and Prochaska in the 1970s. It is called a model instead of a theory because it consists of various stages of change, all of which include different theories and constructs within them. Those stages are like steps that individuals move through during the process, which include pre-contemplation, contemplation, preparation, action, maintenance, and termination. The idea of the model is that individuals move from one step to another. The trans-theoretical model is a model that focuses on intentional change and places a direct focus on decision-making of individuals. The model embraces the idea that individuals do not change their behavior spontaneously. It takes time, initiative, and commitment to do so. For study purposes, the model will serve as a guide to follow when determining where to begin our intervention. For instance, by determining which stage most students are in, the researchers will be able to better understand the intervention group and how to move from one step to another while maintaining that progress. As of now, the theory has not been used in Zika interventions, but it has been used in other behavior change studies. In this case, the researchers will aim to impact behaviors to prevent Zika transmission through sexual intercourse in college students. The model has also been used with college populations, which is the same population this study focuses on. Study limitations include study population, the use of convenient sampling, length and administration of questionnaire to Delphi technique panel, and bias on their behalf. Using human subjects for the study presents a bias itself. Also, only Fresno State students will be part of the study, which limits generalizability of study to other colleges. Convenient sampling will be used, so participants will not be randomized. The length of questionnaire and type of questions are limitations, as well as the method in which the questionnaire will be administered. The Delphi technique panel can possibly rush through the questions or favor specific information based on their expertise. The World Health Organization and Centers for Disease Control and Prevention have been proactive in creating resources to educate individuals on Zika. They have created many resources like toolkits, training resources like presentation slides and webinars, brochures, flyers, podcasts, databases of reports, radio spot recordings, Zika applications, among others. However, one main problem remains. They have created those resources for general populations, health professionals, and pregnant women, meaning that the resources are made at a level for everyone to understand, but does not necessarily target or capture the attention of specific populations. The CDC has a section of resources for colleges and universities, but even that information is the same as the information produced for the general public. This in turn shows the need for resources and interventions tailored for specific populations, in this case, the college population. With previous outbreaks, besides the production of resources, studies have also been conducted, but to this day, not enough have been published for others to learn from. However, there have been a few Zika studies at the community level that have taken place and continue to take place. For instance, Ellingston and colleagues conducted a study in Georgia to determine preferred Zika communication methods among pregnant women in Georgia, and found that the majority of women prefer to receive information through educational brochures and emails. Also, in response to the Zika outbreaks, the World Health Organization recognized the need for studies and created the Knowledge, Attitudes, and Practice surveys to assist health professionals who wanted to understand and address needs in their communities. Data from those studies was then tracked and put into an interactive map to show interventions going on in the world. And in order to monitor Zika, the World Health Organization has been proactive in tracking reported cases, and the CDC has been in charge of tracking national rates. In the U.S., new information on rates and findings is released through the Morbidity and Mortality Weekly Reports, who also provide testing guidelines for professionals and allow them to learn about the latest news on Zika. Even with all this information, there still remains a need for interventions that specifically target college students. The Delphi technique will be used as the main research method. The technique is a method used for the collection of opinions for a specific research question or sets of questions. The technique is based on the idea that pooled intelligence enhances individual judgment, which in turn includes the collective opinion of various experts without it being physically assembled. In this case, study researchers will be the ones assembling that information. Currently, there are three types of Delphi techniques: conventional, real-time, and policy. For purposes of this study, the conventional Delphi technique will be used. The conventional type consists of the classical way to prioritize facts. This works by having a questionnaire sent out to a panel of experts regarding a specific topic. In this case, the questionnaire will ask experts questions on what they think is essential information that college students need to know about Zika, along with other open-ended questions. Once feedback is received, it will be analyzed and educational materials will be produced with that feedback. When that is done, a second questionnaire with a copy of the educational materials will be given to the panel of experts for analysis and feedback. Feedback will be analyzed and changes to the educational materials will be made if needed. A third questionnaire will be administered if needed, and other steps will be repeated as well if they are needed until a 95% consensus by experts is reached. The questionnaires administered to the panel will all be confidential to receive a higher degree of honest responses, although bias will still exist. Experts will be given 1 week time frame to complete the questionnaire. This is to make sure they have enough time since they are all working professionals. The questions administered will be open-ended questions, with the main question being, what Zika information is crucial for college students to receive through health education materials or interventions? And other questions asking, what is the appropriate subject content that should be included in the messaging? What is an effective message distribution method to disseminate Zika information? What type of messaging mechanisms are effective in addressing the target population? And how much information on the sexual transmission aspect is necessary, and how much on pregnant women? Currently, the literature shows the need for education or interventions that focus on college students. Therefore, the focus will be placed on making materials for them. This means experts that work with the population are needed along with other health experts. In this case, Fresno State Health Center staff is needed in the panel. This includes Dr. Thefabong, the Medical Services Director, and Alicia Nelson, the Wellness Services Director, both from Fresno State Health Center. Experts in the health field who have access to various resources and influence over current policies are local health jurisdiction officials and employees. Possible panel experts from this area can include a communicable disease investigator who has extensive knowledge and experience working with patients who are at risk of sexually transmitted infections, a health educator with clinical background who has experience working with the media, campaigns, and the creation of flyers, a health education specialist who works with pregnant women, our biggest risk group for adverse health impacts from Zika, an epidemiologist who manages county data and disease investigation as well, and a public health nurse who works with pregnant women and babies.